Thanks for joining us today. I'm Sam Boyk, and this is Mile High Living. If your child receives a diagnosis of amblyopia, commonly known as lazy eye, it could be concerning. But what if you could give your child the choice of watching TV to improve their vision? I'm sure most kids would be pretty happy to hear that. Dr. Michael Puente joins me from Children's Hospital Colorado to discuss LUMINOPIA's binocular therapy. Great to have you here. Thank you so much.
Yeah, it's great to be here.
Yes. Now, with this, just start us with what is amblyopia and what should parents know about this?
So amblyopia is a disease where a child's brain is ignoring one of their eyes.
Okay.
So the child has good vision in one eye and very blurry vision in the other eye because their brain has learned to ignore that eye. And there are different things that can cause that. One of the most common things that can cause amblyopia is if a child has eyes that are pointing in different directions, like crossed eyes or an eye that drifts out. The child doesn't want to have double vision, so their brain just turns one eye off to prevent the double vision. Sometimes kids can also have a really strong glasses prescription in one eye, and if they haven't been offered glasses yet, their brain can learn to ignore the eye, and then that gives them amblyopia, where they just can't see well with that eye.
Okay. What is the way that this is kind of detected, and what happens if maybe it goes untreated?
Sure. So it's detected through an eye exam, and all children should be getting their vision checked by their pediatrician at their annual wellness visits. They should also be getting their vision checked each year at school. That's required by Colorado state law. And if a child ever fails one of those vision tests at the pediatrician's office or at school, then they should be referred to get an eye exam by a pediatric ophthalmologist. And on our exam at the ophthalmology office, we'll try to figure out what's going on with the child's eyes and identify why they're not seeing well. And we can diagnose them with amblyopia.
Okay, and if it does go untreated, are there any concerns down the road?
If amblyopia doesn't get treated in childhood, then the brain just gets set in its ways and the child will never have good vision in that eye. Amblyopia is something that has to be detected and treated in childhood. You can't treat amblyopia in an adult.
Okay, how common is this in your patient population?
It's extremely common. It's the most common cause of vision loss in children. It affects about 3% of children. So in a typical classroom, there's probably one kid in there with amblyopia.
Okay, how would this traditionally be treated? Are there any limitations by those traditional treatments?
There are lots of treatments for amblyopia. First of all, we have to figure out what's causing the amblyopia. It doesn't just happen without a cause. So if the child has eyes that are pointing in different directions, then we may need to do a surgery to straighten the child's eyes first. If we find that the child is very nearsighted or very farsighted and needs glasses, then we prescribe them glasses first to address the underlying cause of the amblyopia. But oftentimes, even when we straighten the child's eyes or we give them their glasses, the brain is still limiting how well the child can see from the eye that it's been ignoring. So we need to do treatments to force the child's brain to use that weaker eye more. Historically, we've had a couple main options. One of them is patching, where you can put a patch over the child's stronger eye and force them to use that weaker eye. And that works really well for some kids, but it doesn't work well for every kid. Some kids rip the patch off, they really don't like it. But that's been our tried and true treatment for decades. Another option is putting a dilating eye drop in the child's good eye, and that blurs their vision in that eye and forces them to use the weaker eye more. But lots of children really hate eye drops, and that option can work really well for some families, but not for others.
Okay.
In the last few years, there have been some new treatment options that are coming available using modern technology. LUMINOPIA is one of them. It was FDA approved about 5 years ago, and children use a virtual reality headset that they wear about an hour a day, and they just watch cartoons. And each eye is shown a slightly different version of the cartoon. The headset tries to basically trick the child's brain into using that weaker eye at the same time that it's using the stronger eye. And that's a new option that we have in our toolbox in addition to patching and eye drops.
Great. How have patients and their families responded to this?
They tend to like it a lot. I have some kids who've been upset when we said they don't need the treatment anymore. They've been upset about discontinuing it. A lot of families find that it's easier than patching or drops, but it's just good to have multiple options available because no one approach works for every kid.
Okay, we have just about 30 seconds left. How would you recommend that parents out there can get their child started on Luminopia if that's necessary?
Yeah, if your child is having trouble seeing, if their pediatrician or their school identifies they're not seeing well and they see an eye doctor and we find that they have amblyopia, an ophthalmologist or an optometrist can prescribe this. It has to be prescribed from an eye doctor.
That's wonderful to hear, and thank you so much for bringing this important information to our viewers today.
Thanks for having me.
And Luminopia is a digital health company pioneering a new class of treatments for neurovisual disorders, including the FDA-cleared binocular therapy that uses a VR headset to stream a child's favorite show as a treatment for amblyopia. To learn more, visit luminopia.com. This was a sponsored segment. We'll be right back.